Hi there. So it seems that you came here for a little plastic surgery consultation. Right. You're not content with how your face looks. I can see why. So, if you wouldn't mind, first and foremost, please do me the most amazing favor of signing away some very circumstantial, unnecessary, super superfluous rights of yours. I just need you to sign this real quick. Just some documents. Thank you. I really appreciate your cooperation. It really gets things underway quicker. So, tell me, what are you looking to get done? Although honestly, I think a better question is, what are you looking not to get done? I see. So you're looking to, may I touch? You're looking to get a little bit of a facelift. Okay. Are you looking to get the buccal fat removed? No? What about a little cheekbone implant? No? I think we're going to be needing a buccal fat removal. I think that'll kind of make your face look a little more composed, kind of more cohesive. And I think we're also going to be needing a buccal fat. In fact, give me one moment. I'm just going to be marking this down. I think actually your cheekbones are absolutely perfect for reconstruction, complete reconstruction. I'm just going to be highlighting this a little more. Yeah, it's going to really bring a lot of depth, a lot of character, a lot of youth to your face again. You're going to notice that you're going to look better than Gigi Hadid, Bella Hadid. I mean, they're 43 years old. Or however old they are. I don't know. I'm going by model years. So, next, I think the next thing that I want to actually adjust with you is perhaps the ponytail facelift. Although, are you looking for a ponytail facelift or are you looking for a complete facelift? You just wanted a little bit of a Botox. I think you might not be the most perfect candidate for Botox just because your skin does look a little wrinkled. I think a better alternative is just the facelift. I think that would suit your face a little better. Basically, we would just be making very small incisions up here. Yeah, just very small incisions along the hairline. And we would do a simple little just face peel and then just stitch it all back up over your face again. It's kind of like a horror movie where they staple the face over another person's face, or like Hannibal Lecter when he was in the elevator and he takes one of the security guards' face off his face and then he puts it onto his face. It's comparable. So we're discussing a cheek implant, buccal fat removal, facelift, loving it. Are you interested in the elf ears? Grimes really put it onto the map, really popularized it. I myself would personally recommend the elf ears. It'll definitely give you a very youthful, ethereal look. Yeah. Do you happen to have a job? Don't worry, it's a noble sacrifice for beauty. So we're just going to be giving a little bit of an ear lift here. Just a little bit of an ear lift right there. A little bit of an ear lift right there. Perfect. Okay. Now, let me see. What was that? You were just looking for Botox? And you've discovered so many more. So I'm going to be probably maybe making your chin a little more V-shaped. Yeah, I think that's the new Korean beauty standard. Although I think it's Korean Japanese beauty standard where it's like the V shape like this. So I think I'm going to be shaving down your jawline, giving you a very defined, sort of perfect little heart-shaped chin. Give me one moment. I'm just going to go in and I'm just going to get a little bit more detailed right there. Perfect. Yep. Just a little bit more. This really just flows so perfectly. You're going to be looking like a Tim Burton character after I'm done. There we go. Yes. Love it. Oh, it's exquisite. Okay. Perfect. look at me. I think perhaps, maybe, yeah, no. One more procedure. We're also going to be lifting the tail of your eyebrow upwards like that. Tail of the eyebrow upwards like that. The foxtail look. So we're just going to go in, and we're just going to give it a little bit of a lift. And we're just going to give this a little bit of a lift. Okay, perfect. How are you feeling about this right here? I'm absolutely loving it. I adore it. It's all perfection in my eyes. It's like literally just so you. I can really feel like your personality shining through. I don't know your personality. I can feel the vibes of it. I can feel the aura of it. And I can definitely see how your vibes and aura are being more thoroughly channeled through your face now. What was that? I just met you. I feel like I've known you for such a long time, especially since the amount of debt you're about to get into is going to mean that your name is going to be popping up in my debt collecting bill for a while too. So I'm just going to get you a little bit prepared for surgery. I'm going to be putting this headband over your face. I'm going to ask you to just stay still for me. I'm just going to be putting it. Perfect. And now before we begin, I just want to take your temperature. That way when we put you under, you're going to be quasi-awake. You're not running a fever, which might make you fall ill. Yeah. So open your mouth for me, please. Lift up your tongue. Okay, perfect. Lower your tongue for me, please. Okay. Perfect. You have an excellent temperature for having your face completely restructured. So now I'm going to be putting some simple anesthesia over your face. Just breathe in. Take a deep breath in and out. In and out. Perfect. Now, just to make sure that if you wake up during the procedure, you're not going to freak out as we're cutting through your face, I'm just going to tie you to the bed. Perfect. Okay. Where's my supplies? So, facelift, eyebrow lift, cheekbone implants, buccal removal, chin shave. Let's begin with the chin shave. Alright. What was that? Mask and gloves. Sanitary practices? It's fine. It's completely fine. I know what I'm doing. I'm just gonna carve it into this jaw real quick. Nurse, give me some Febreze. The patient's jaw shavings keep floating into the air and it smells like jaw shavings. So I'm just gonna go to the side and just complete the other side. Just make it nice and balanced. Just allow it to be the same on this side. Very nice. I can already see how beautiful the patient's gonna look afterwards. So beautiful. Pretty even. Let me just find a little salve. Fluids, please. Fluids, nurse. Nurse, some fluids. Thank you. Just put some little bit of fluids in there, just allowing it to be a little more. Okay, perfect. And now, just to light it into place. Just light it into place. Beautiful. And onto this side, light it into place, light it into place, light it into place, light it into place. Very beautiful. I think we're going to begin with the forehead incision. Yeah. Let's see. We're just going to cut in through like a little can. Just opening up your forehead like a can of Campbell's soup. Okay. And now, to peel it off, just quickly, just to peel it off. There we go. Yes, I've touched skull. Okay, there we go. Yep. Okay, perfect. Just get the little major skin patches off her face. Alright, so now it is time to remove the buccal fat. So if I could just, here it is. I'm going to be drilling a hole into her cheeks, removing the little fat pads from her cheeks, making her look 47 years old, but in a nice way. In a way that if you naturally age that way, it's wonderful. And then proceeding with the cheekbone implant. Just go in and remove this fat pad. Very good, very good, very good, very good. Okay, now I'm gonna go in and remove this little fat pad over here. Yep, remove this little fat pad. Yeah. There we go. Fluids. I'm just gonna be adding a little bit of fluid in there, just a little bit of fluid in there, just wherever you're not just losing too much blood, anything like that. And then, oh, I singed the corner of their mouth. That's totally cool. It's just bone. I'm just gonna touch it. There we go. Very good. That way we don't waste money on the stitches, but we still upcharge on the recovery or on the stitching process, the melting process. The melting process is cheaper, but it seems like it's more effective, so we charge more for it. So I'm just gonna be, there we go. Okay, perfect. So now for the cheekbone implants. What? How sanitary is it to touch my own mouth and the patient's unskinned or skinned face? Completely. It's 100% sanitary. Are you saying I'm a dirty person? That's naughty. Now, I'm going to be adding the cheekbone implants. So just going to be stitching this in real quick. There we go. Just gonna stitch in this implant. Implant, very good. Stitching. This new implant. Okay, very good. Now for the other side. Oh, God. Beauty is so ugly sometimes. Okay, I'm just gonna stitch it. There we go, yeah. Stitch in this new. Oh, it's so stunning. It looks wonderful on the patient. Okay, one more. Okay, perfect. I missed. Oh, I missed. It landed right on her cheekbone implant. Okay. Ah, there we go, yes. Alright, more fluids. Can never have enough. Perfect. Yes, excellent. Okay, Very good. Now to stitch it all up again. Stitch it all up. Perfect. Stitch it all up again. Stitch it all up again. Perfect. Now to stitch her face back up to her face. Yeah, now to stitch her face up to her face. So, let me just put this face right on over, peel it back up. Perfect. I'm just going to stitching this right back over here. With this medical grade tape, I'm going to be just stitching it all up there. Nice. I'm just going to be stitching this one up here. Nice. And the last one, I'm going to just be stitching this one up here. Very good. Eyebrow lift. Now, nurse. Where's the tools that I need for the eyebrow lift? Oh, here they are. Thank you, nurse. I sometimes get a little confused. Okay, let's see. Alright. So I'm just going to be going in and just stitching up this little eyebrow up here. Very good. Yep. Very good. Yep. Okay, good. Now onto the other eyebrow. Just going to be stitching this eyebrow up here. Very good. Yep. Yep. Stitching this eyebrow up here. Yep. Yep. Very good. Okay, good. 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 Stitching this eyebrow up there. Very good. Excellent. Now to unchain the patient from the surgery bed. There we go. Excellent. Hello? 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 Are you awake? I'll let the patient rest off the fact that her entire face has been reconstructed. Just remember that each hour is about $3 grand worth of a stay at minimum in this hospital. At minimum, meaning it's not just going to be $3 grand. So let the patient rest. Just keep an eye on the clock. Okay. Her face is perfection now. Until later, when she regrets her face, then she will return for more. They always come back for more.